Contraceptives. Last time we met, we started a conversation about knowing your contraceptive options. I mentioned that it's going to be in 3 episodes, so today is the second episode. And so to help me with the discussion, I have here with me Auntie Rita and Auntie Juliana, who are both midwives. We are going to have the discussion for today as well. And you are going to join me, as this program is an interactive one. Send in your comments on our live show now. You can also send in your comments on our social media platforms at Lydia Contraceptives, on Facebook, on Instagram, and on Twitter. You can call us on 1221, and you can WhatsApp us on 050-166-1660. Don't forget to invite your family and friends so that they can all benefit from this. And so you can share this link, or you can just call them now. Let them join live, and so we can have a full discussion. So we'll begin right now. Auntie Rita, with your smile, please tell us who is eligible for contraceptives. The last time we spoke about the benefits, and I'm sure by now everybody is interested, but they want to know if they are suitable to take it.
Okay, so when you talk about eligibility, we are basically talking about who qualifies to take it. Yes, so we are looking at all women, nearly all women within the reproductive age. When we talk about reproductive age, we are talking about from 13 who are, having their menses, 13 way up to 45 and 50 for some people who are still giving birth at 50. So within this age bracket, any woman can have it. Okay, whether the short-term method or the long-term method. So any of them.
All right. So you don't need to be bound by age or anything that's like a barrier to you right now. Don't be confused. As long as you are you're already having intercourse, or you're already having sex, and you are likely to get pregnant, but you do not want to get pregnant, you can take in contraceptives.
Yes. So if we are saying this, we are not saying that. All that we want to say is that they should come to us. When you come to us at each stage, we can discuss and we can find a method for you.
All right.
And then to add on with the eligibility, as she said, all women in the reproductive age can access the contraceptives. But then we have some who have certain conditions.
Okay.
So if you have that condition, as she's saying, don't be afraid. Just come. We have the eligibility criteria wheel.
Okay.
We have something like a wheel that all conditions are noted on it. So if you come, we will wheel your condition and then know which commodity or method that is best for you. Please, don't be afraid. Just come. Whether you have hypertension, diabetes, sickle cell, HIV/AIDS, whatever. The condition that is not stated on the eligibility rule, it means that that condition doesn't even exist.
Okay.
So it means that we have everything. So don't hesitate to come. Just come.
Yes.
We will help you to assess your contraceptive goal.
All right. This is good to know. So if you want to visit our lovely ladies, well, you can do so by walking in their facilities, but you can also equally call us. Okay, you can call the Lydia Contact Center 1221, and then you can WhatsApp us 050-166-1660 and join us on all our social media platforms. We can equally assist you to advise you on which method will be best suited for you, for your age and for your condition.
Yes.
Right. All right. But Auntie Juliana, can men use contraceptives?
Yes.
Are they involved?
Men are involved. We can't leave them because we are having sex with the men. Yes. We are having sex with the men, so we can't leave the men out.
Yes.
Men can also come for contraceptives.
So what are the options available for them?
They have the condoms for the men. So we have varieties of condoms. We have the Fiesta, we have the Doomso, we have the Kiss, we have a lot. We have the all night long.
Yeah.
If you want to go 3 hours, come, we'll help you.
The Fiesta condoms are quite interesting. They're different variants. They are quite interesting.
Yes. And then we have the vasectomy. That is the permanent one we talked about.
Okay.
If you don't want to have any children again, like if you have like 4 children, 5 children, 6, you don't want to have again, come. You just a matter of signing a consent, knowing that it is permanent, meaning it is not reversible. It is permanent. We have it for the men. That is the vasectomy.
Okay.
Yeah.
All right.
Okay, so just as Auntie Juliana said, we have the condoms, some types. You know, for our men, they said they want it raw. And so just as you said, they don't want to eat the toffee with the wrapper on it. So when you come to, we have another brand, of condom that is so thin, like when you wear it, you don't even feel that you are wearing anything.
Really?
Yes. And so when they come to the facilities, they can come and discuss with us. We have a lot of them in the facility, and it's so helpful.
If it's as thin as you are describing it, is it going to be durable?
Yes, very, very durable.
Okay.
Very, very durable.
Okay, so if you want to take your toffee without the wrapper, then we are going in for you need to protect the woman. But as a man, you can take the condom to prevent pregnancy and prevent sexually transmitted disease.
Point of correction. The type of condom I was talking about, we call it the extra thin. So when you go to the pharmacies, when you go to the family planning providers, you get it. It's called extra thin.
Okay.
And it's very, very thin to the skin. You won't feel anything.
That one, you feel the skin to skin, you want to feel.
Yes. It's nice.
All right, so if you want to go for the vasectomy, it means that you've made that decision that you are not going to have children any longer.
Yes.
All right, and then the short term is the condom, right?
Yes.
Talking about the condoms, so we have the Kiss and then the Fiesta brands. And the Fiesta, quite interesting. It has so many variants. We have the one that glows in the dark. There's the extra thing for those who want to go, have that raw feel. It's so thin that you will not even feel like you're wearing a condom. There's the strawberry, so many variants. You can call us. You can contact us on 1221. You can call WhatsApp us on 050-166-1660. And then on all our social media platforms as Lydia Contraceptives, we will be able to refer you to any pharmacy or any shop where you can get these variants, these different variants. That is going to make your sex life very, very, very interesting. Auntie Rita, I like your smile. But how do I know which contraceptive to go for, or which one is safe for me, or which one is convenient for me?
Right, thank you. So we have a lot of them. We have different types of contraceptives.
Yeah.
All that you need to do is to visit any clinic or facility near you. Or as you said, you can call the Lydia call center for them to assist you to a facility where you can get access to a contraceptive. And you go there, you go through the wheel, as my sister said, and then there is counseling. You choose the method you want, and then it is done. Thank you.
Auntie Juliana,
Yes,
just to add to it, what do you think? Apart from them reaching out to us, what are some of the things that they must consider? Because there are different types, and so are they going to consider their age? What are some of the main things that they have to consider to make that choice?
Actually, if you decide to take a contraceptive, it is just a matter of the method you want to choose. And that one, after the counseling, is an informed choice.
Okay.
So we have a lot of the commodities. We have the Lydia Safe Load, we have the cyanide press, we have the Jadel, that's the implant, a lot. So you just have to choose. and it is done.
Okay,
Yes.
okay. We need to get into the different types. As you've already started mentioning them, we need to pick them one by one and talk more about them because it's all about convenience, right?
Yeah.
Which one is convenient for you? Which one is safe for you? Which one can you do? So, Auntie Rita, she mentioned the Lydia Safe Load.
Okay.
Yes. What is Lydia Safe Load?
Right. So Lydia Safe Load is basically an IUD, what we call copper T. Okay. And then it is placed in the womb, for 10 to 12 years.
Okay, meaning that it's a long-term contraceptive.
It's a long-term contraceptive. Yes. And so basically you have to come to the facility for them to counsel you before you can take the method.
Meaning that you cannot do the IUD on your own. You need to visit a health facility and get a health professional to assist you to get the safe load inserted, right? But we need to add that it's reversible. So don't mind the 10 years or the 12 years. Don't be alarmed. Even after a year, you change your mind and you want to get pregnant. As soon as we take it out, you will be able to get pregnant, right?
In fact, Nana, it's not even after a year. If I insert it today for you and tomorrow you change your mind, you want to take it out, we can take it out. No problem.
All right.
So at any point in time, you make a decision to have children, to do other things, we don't have a problem. You come back and then it doesn't really mean because it expires after 10, 10 to, it means that you have chinchina. No. So that it wouldn't make you feel, oh, they said it's 10 years, so no, I can't wait for 10 years. No.
Okay.
If it is 2 years, just fix, we'll put it there. In 2 years' time, come back, we'll take it off, go and have children, and then everything will be fine.
All right. Auntie Juliana,
Yes, ma'am.
we also have the Lydia postpill.
Yes.
Can you tell us about it?
Okay, with the Lydia postpill, it is also called an emergency pill. We use it in cases of emergency where you feel that you become pregnant. That's where you take it. So it's right after the intercourse. And then you can take it within 72 hours to prevent the pregnancy. And we have the single dose and then we have the double one. So when you go to the pharmacies or you call the Lydia call center 1221, they can direct you as to where you get it.
All right.
But Ikria, we want to add that the earlier you take it, the better.
Okay. Yes. All right. So, but what about the daily oral pill?
Right. So with the daily oral pills, it comes in a blister of about 28. So we have the first. It comes in colors.
Okay.
When I say colors, we have 2 shades of colors on the
Okay.
on the blister. So we have the first 21 white active pills, and then we have the brown 7
Yes.
inactive or iron.
We
iron
mentioned
pills.
it in our previous
Yes.
episode that the iron pills were actually yes, it helps in
Building your age.
yes.
So you are supposed to take it daily, and at the same time you took the first dose. So supposing I started taking it today 6 p.m. It means that every day you try and make sure that you take it at 6 p.m. until you get to. It is assumed that before you get to the brown one, you'll be in your menses, and so the brown or the iron tablet helps you build your hemoglobin or your HB, or build your blood around that time.
Thank you, because that's it. Yeah, technical
Bro,
background.
bro.
So basically, we are saying that it replenishes the blood that you're going to lose.
Yes.
Okay. So Auntie Juliana, we also have the Lydiadaphne, which is also a daily oral pill, right? Yes. Can you tell us more about it?
Yes.
What's the difference, basically?
Okay, with the Daphne, it is oral pill, as you said, and it is a contraceptive. But then it has extra benefits to the woman who is taking it, especially those who have dandruff, a correct dandruff. But it's not about taking it once and you want your dandruff to go away. No, you have to take it at least 3 or more cycles. It also corrects alopecia. And banon ti apan.
Okay.
Almost 18 wow.
Okay.
It also reduces the male hormones because it's hormonal.
Yeah.
It's a corrected hormones, with those who have the hairs and all that.
Yeah.
It reduces the androgens in them so that all those hairs vanishes. But send a can just once. It's or started say or farm and then can say, oh, me fa back up no. The kind of Debbie. It takes time. It may or may not. It may.
Yeah. Okay. So basically, these imbalances which are caused by hormones.
Yes.
That is when the Lydiadaphne comes in to correct them. Okay. All right.
So even they can call the Lydia call center 1221.
Exactly.
So that you give them more an explanation.
Yes. So don't get confused. Get in touch with us and we'll discuss more into details what the Lydiadaphne has in store for you.
Yes.
All right. We also have the Lydia Sleek IUDs. So in the Lydia IUD, there are two. We've already discussed the safe load. What about the Sleek?
Yes. So for the Sleek, it's also an IUD. Yes. But you see, when we're talking about the safe load, we were looking at 10 years is a long time.
Yes.
10 years is a long time. 10 to 12 years is a long time. And so for Sleek expires after 5 years. And so those who don't want to go in for the 10 years can come for the IUD, which is also 5 years.
Okay.
So I think provision has been made for all. So whichever year you want to use your contraceptive,
yes,
you can use it.
Yes, and I know that the IUD is non-hormonal. So for those of us who want to go for something which is non-hormonal, you can choose between the Sleek IUD, which is 5 years, right? And then the Lydia Safe Load IUD, which is 10 to 12 years. All right, okay. But you also mentioned the Cyana press. Yes, can we talk more about it? The Cyana, it's a type of injectable, right? I was fascinated by the fact that you said you can even do it yourself.
Yeah, with the Cyana press, it's a 3 months injectable.
Okay.
And for the first time when the client comes, the provider will teach her how to inject it herself.
Okay.
She can inject it on the thigh, on the side of the abdomen, but then she can't inject on the arm because if she does this, she has to press the sides before she injects. So she can do it on the thigh or on the abdomen. So you give it to her, maybe 3 months supply or 6 months or a year or more. Once you know your client can inject it correctly, you give it to her to take home.
Okay.
Then once she injects, she gives you the feedback.
All right.
She has any questions she can come or call the call center.
Yes. I find this to be very, very convenient. I mean, to have this at home and for like a whole year, you don't even have to go to the health facility to get the injectable done for you. So if you're interested in this, kindly call us on 1221. You can reach us on WhatsApp 050-166-1660, and then on all our social media platforms, Facebook, Instagram, Twitter, you can reach us on @Lydia Contraceptives. We'll be able to direct you to the nearest facility or with the nearest health facility where you can get the Cyana press and then take home and do it yourself. Amazing. All right. And then the level plant. You mentioned as one of the implant methods. Yes, but the level plant is the Lydia brand. Tell us more about it. What want to know about it?
Well, just as you said, it's an implant, and then it comes in 2 rods, soft and then white in color. Just as I said.
That's the one that is the size of a matchstick.
Yes. And it's placed just under the skin.
Okay,
for a period of 3 years.
So they are going to cut your skin
no. We have a very simple technique.
Okay.
Within a twinkle of an eye is there. And it's not going to harm you, not going to harm your arm, it's not going to stop you from doing anything.
So while it's there, you're going to be able to go do your activities, your daily activities.
Sure. No,
You're not going to feel.
No interruption.
You're not going to feel its existence
No.
while you're going about your duties.
No, not at all.
So viewers, this is quite convenient as well. You know, you can just have this for 5 years. Did you
For
say?
3 years.
For 3 years.
Yes.
Okay. But it's reversible, right?
It's reversible. Whenever
right.
you feel you want to have children, you come back and then, or for any other reason you want to take it off, you just come back and then.
All right. So there you have it. These are the various types of contraceptives available for you. If you want more information about any of these, or you are confused about any of them that we have mentioned, you can call us on 1221. You can reach us on our social media platforms, Facebook, WhatsApp, Twitter, at Lydia Contraceptives, and you can reach us on WhatsApp 050-166-1660. You are going to get a prompt response from the Lydia Contact Center. So we are going to have to end today's session. We are going to continue with our third episode, and we'll talk more about contraceptives. From Auntie Juliana and Auntie Rita and myself, Mame Kriya, it's bye-bye for now.